So we're looking at a group of infection. It's not one infection. So it's a group of the infection that they collectively called touch infection. So this touch infection is actually what? A mnemonic, So it's a mnemonic. T means something, O means something, R means something, C means something. Alright. So for most students watching this, or for most patients watching this, basically they want to know the full meaning of touch. Alright. So you can see that touch means was Toxoplasma, that's a T. O is other pathogens like syphilis. R is Rubella virus. C is Cytomegalovirus. H is Herpes simplex virus. Okay, so it's just a group of congenital infection. So they are passed from what? A pregnant mother to her baby. All right, maybe during the course of pregnancy or when they wanted to deliver. The baby was bleeding, the mother was bleeding. All right, there was a mix-up of blood and all of that. Or sometimes after birth, maybe through breastfeeding and stuff. Do you understand? So the acronym TOUCH stands for what we were talking about. T is Toxoplasmosis. O is what? Other infections like what? Syphilis, HIV, varicella-zoster, parvovirus, R is what? Rubella. C is what? Cytomegalovirus. H is what? Herpes simplex virus. Okay, so these infections are especially concerning because they can interfere with how the baby will develop properly. Because babies are weak. All right, disease conditions that we can withstand, babies will find it hard to withstand. Okay, so how are they spread? All right, through pregnancy through placenta during pregnancy, vaginal delivery, all right, wound here and there as the baby is passing through the birth canal and all of that, through breastfeeding too. Okay, all right, see. So these are all complications that could come up in babies. Brain malformations, all right, small eyes, pneumonia, hepatitis and jaundice, skin infections, the spleen is enlarged, heart defect, a lot of things, right? So what are the possible effects on the baby, looking at it properly? So it could cause miscarriage, or you give birth to a baby and the baby is almost dead. All right, premature birth, low birth weight, microcephaly, the head size is very small, hearing loss or vision loss, congenital heart defect, neurological issues like the baby can have seizures, have developmental delays, baby can have skin rashes, baby can have jaundice, baby can have a liver that is enlarged, baby can have spleen that is enlarged. So diagnosis is just blood test for mother and baby. All right, polymerase chain reactions because you want to dictate the virus or bacteria. Ultrasound imaging if you want to look at the internal environment of the body. Newborn screening after birth. All right, so treatment depends on what is, all right, depends on the infection. We are not saying the baby must have all of them. Can have one, can have two. Do you understand? So Toxoplasmosis is just antiparasitic medications like pyrimethamine, sulfadiazine. Then Cytomegalovirus is antivirals like ganciclovir, acyclovir. Syphilis is antibiotics like penicillin. HIV, antiretroviral therapies.